Should start? You don't start the record? Huh? Alright. Are they sure? Are they sure? Alright. You don't set to?
Yeah.
Now when I want to talk now, you will not shoot doing the editing. The big gist with another great person, which is Dr. Abdurrahim Agbebe. You know, I promise you that I'm going to be bringing wonderful program. This time around, I'm here with a great man from Agbebe Herbal Hospital, Dr. Abdurrahim Agbebe. So, well done, sir.
Thank you.
We are in big gist.
Yeah.
So I want you to tell us more about yourself first.
Okay. My name is Dr. Abdurrahim Agbebe. I basically, let me just give a brief intro about myself.
Yes.
So I'm a medical doctor.
Okay.
I did my training or had my house job done at Tema General Hospital the first year, where I did surgery and pediatrics.
Wow.
Then after that, I went to UCC Hospital, University of Cape Coast Hospital, for also 1 year.
Cape Coast is still in Ghana, right?
Yeah.
Okay.
Yeah, it's still in
Ghana.
Ghana.
Two hospitals you mentioned now are in Ghana.
In Ghana. Okay. One is in Tema. The first one, Tema General, is in Tema.
Okay.
And then Cape Coast University of Cape Coast Hospital.
Okay.
It's also in Cape Coast.
Ghana.
That's the central region, but in Ghana, it's in Ghana.
Okay.
Yeah.
Okay.
It's where I did medicine and then obstetrics,
Okay.
obstetric and gynecology.
Wow.
So then after that, we are waiting for our postings for government to post us, but I have deemed it a privilege to help what my dad or my father started, so that we build upon it and then improve upon it. So that is the aim, and that is the wish.
Okay.
So
now, how do we call you? Do we call you a herbal doctor, which is popularly known as a herbalist, or a gynecologist, or how do we call you?
For now, I'm a general practitioner.
General practitioner.
Yes, okay. Because I have not specialized yet.
Okay.
Yes. So I'm a general practitioner. Maybe when I specialize into obstetrics and gynecology, okay, then you can call me an obstetrician or a gynecologist. Or when I specialize into medicine, and even in medicine there are sub-specialties. Okay. So, or surgery or a surgeon, then you can determine. But for now, I'm a general practitioner. Okay. Because I've not specialized yet.
So another question is this. Here is Agbebe Herbal Hospital.
Yes.
Like, can you tell us, like, how old do you think Agbebe brand himself name, how old do you think the name is in the field of medicine?
The brand is older than me.
Okay.
My dad started this 40 years ago, before I was born. But the company Agbebe was registered somewhere in 1999. Officially registered somewhere in 1999.
Yeah.
So it's a very old brand. That's why it's a household name.
Yeah.
Very old brand. That's why I'm also saying the brand is older than me. Because since they started, I wasn't born when they started.
Oh, wow.
So maybe I joined on the way.
They start the company here in Ghana or where?
They started in Ghana, okay, specifically Abeka. Okay. Abeka, where my dad and mom used to stay.
Okay.
Together with my.
That's 1990 something.
Yes, that's 1990 something. That's the early 1980s.
Okay.
Thereabouts. That is when my elder sister, the firstborn, was living in 1980, I think 83 or so. That was when the elder sister was born. So it's that's what I'm saying. It's a very old brand. Those times, he started as a clinic, a small clinic. Then he added outstation medication like drugs or medications to sell. Okay. And then from there it has improved because he also schooled us. That is one good thing the old boy did for us. He schooled us to the highest. Everybody had at least a degree.
Wow.
Yeah, so we came in just to help and improve the brand. And we are still improving the brand. And then the target or the aim is to make it one of the best herbal services or healthcare services in the world in the year possibly 2030. That's the target.
Vision. Like now in Agbebe Herbal Hospital, now which services, like what and what? Like for example, person come to your hospital now, what and what will the person expect? Or what do people offer?
Very good. So when you come to the hospital, it's a health service department where we render health services.
Okay.
So for instance, someone comes in to the OPD, we assess the patient, and then if the patient needs to admitted, depending on the condition, we admit because we have the ward services. Okay. But if the patient doesn't need the ward services or doesn't need to be admitted, we give the patient medications which are purely herbs to take home, which are also approved by FDA for the patient to consume.
Okay, you don't give out medicine, anyhow medicine?
No.
Apart from approved ones?
Yes. Okay. By FDA.
Okay.
So when the patient comes in, now due to my experience, me having being a general practitioner or a medical doctor, what I've come to do is to improve on the ward services. For instance, now we've added healthcare, as in orthodox healthcare. So patients who need maybe orthodox medication, we also do it here because now that is why I'm here, to improve or to add that service. So now we just don't give herbs too. We've also added.
Let me ask you this question because I know that viewers now, they will like to throw this question now.
Yes.
So which means here you treat with herbs or normal orthodox drugs?
Very good.
So anyone the person needs?
Anyone the person needs, depending on the person's condition. Okay. So for instance, the patient comes in, let me say malaria, uncomplicated.
Okay.
Malaria, he comes in, but the parasite counts are so high, let me say 100,000. Okay. What we have to do is to admit the patient and then give IV artesunate. You understand? Okay. So IV artesunate is an orthodox medication.
Fantastic.
So yeah, so when we give that, and then not only that, because when the patient comes in with uncomplicated malaria, there might be some kind of headache, some kind of general malaise or lethargy or whatever it is. Okay. So you have to make the patient comfortable. So we will admit you to the ward, which the hospital already has. So we admit you and then make you comfortable, start medication, which is IVs, which is orthodox medication. Then after we finish the dosages of the orthodox medication, then we give you the herbs to continue as orals. So it's the same thing where in the orthodox setup where you'll be giving medication, IVs, then switch to oral ACTs or antimalarial. Here, when you are going, the only thing we do is we give you the herbs and then which is approved by FDA. Then
And
you
the
take
herb
it.
itself is highly effective.
Very highly effective. You see, that's why I'm saying the Agbeve is a household brand. The brand is older than me.
So people watching now, they would like to ask this question: can one find your product outside the hospital? Like if anyone needs any of your product now, can the person see it or get it from pharmacy?
Yes, we have. To the best of my knowledge, we have about 10 products that are being sold on the market.
What are the names?
Yeah, so we have Agbeve Tonic, which is the main known brand. Agbeve Tonic, which is for menses and then menses related disorders like pain, menstrual pains.
Wow.
And then
like women having menstrual pain.
Very good. It's it's very known. It's very common drug on the market, the tonic. Wow. That particular medication is older than me as well, because that is what my dad started with. Wow. Then it's some other ones came to add, like Agbeve Fever or Piva, Agbeve Venous Gota, Agbeve Typhi, Agbeve Tea, Mona Cream, Mona Soap, Agbeve Balm, and so those are some of the main products we've added now. Some
men will ask, why is it that your product is just for, does it mean that all your medicine are made for female?
No.
Or women, let me use the word women.
No,
you have
not
medicine for man? Like
yes.
Some of my guys, they would like to take medicine for,
we have, you see, we have medicine for treatments for men and women who have sexual arousal problems. Maybe there will be a man, the libido, let me use that word, the libido is low, or some women also, they don't feel for sex. So these are treatment medication, not aphrodisiac, remember, because aphrodisiac just works for a short time, and then
so many people will not understand the word aphrodisiac. So like break it down so that we'll carry everybody along.
So basically, aphrodisiac is a chemical agent.
Okay.
Yes, that is put wrongly into a herbal medication.
Okay.
So now FDA is even strict on that. Some time ago, I think 2-3 years ago, they were clamping on medications or herbal medications, but in them secretly were aphrodisiac. So aphrodisiac, like I was explaining, is a chemical compound which gives you the desired sexual libido or arousal within fast. Yes, but in our setting, which is the Agbeve MW capsules, it's purely treatment. So it treats the ailment, not just giving it and then giving the arousal or libido within some short minute and then that it wears off. No,
so
that is not how it works.
The name of the medicine is Agbeve MW capsules.
Capsules, yes, please.
So if I move now, I go to any pharmacy, I can get it?
Sure, you get it.
Wow.
Any pharmacy.
Agbeve MW capsule.
Yes.
Now down here. For those of you in Nigeria, cool down. The medicine is coming your way, okay? I know most of you will move to pharmacy now, pharmacy shop to get the drugs, but nobody has said the medicine is not there yet. But very soon to be there. You understand? Okay, tell us now. I need, for example, here, do people do anything like operation, like to operate someone?
Very good. You know, like I said earlier in my submission, you see, the hospital was running as a herbal facility purely.
Okay.
But since I have been here, I've been trained. So since I have been here, I am just adding on to whatever they have. They already have the facility. So surgeries are not done yet, because to do those things, those procedures, you need to get some accreditations, which we are working on. So very soon, those things will be done.
Okay.
In addition to the herbal that was already here. So very soon we've started with some procedures, which by God's grace everything is falling through. So with time we'll add those surgical procedures as well.
Okay, let me ask you this question. Like, how many hospitals do you have now?
For now, we have the main branch at Accra here, Sotum.
Where in Accra?
Sotum, last stop specifically.
In Accra?
In Accra, Ghana. Sotum, last stop.
So like for maybe people watching you now, for example, someone wants to bring his or her person or himself or herself from his own country to just to see you face to face.
Yeah.
Like you say you are in a Sotum.
Yes.
So the person will just come to Sotum and start.
If you are in, let me finish the branches first.
Okay.
Then I'll come back to your question.
Okay.
Yeah, we have 3 main branches.
Okay.
One, the main one, or the HQ headquarters being in Accra, Sotum, like I said.
Okay.
And then we have one at Adakojachi in Kumasi. Yeah,
okay.
In the Ashanti region. And then we have one in the Volta region, which is Ho.
Okay.
Yes. So now,
give us the full address so that it will be easier for them.
Yeah, the address, the specific, as in for, you want the address for the HQ, the headquarters?
Yes.
Okay. So, for anyone who is even outside or in Ghana,
yes,
if you want to locate us, we are at Sotum last stop.
Okay.
If you want to reach us through email is agbeveherbalcenter@yahoo.com.
Okay.
Then if you want to maybe visit us, we are already, like I said, at Sotum.
Okay.
But maybe someone doesn't know where Sotum, someone is in Accra, but he doesn't know where Sotum is located.
Yes.
So you can just call these numbers.
Okay.
050 211 5509.
Okay.
050 211 5509. Then we'll show you the location so that you can come.
Thank you very much.
Yeah.
This is Dr. Abdurrahim Agbebe. He's a medical practitioner, general practitioner for that matter. So, for that your problem, don't worry. Just call the number showing on your screen. Bye. This is Big Gist. Thank you, sir.
You're welcome.
Wait for the editing. And